Hello, and thank you for being willing to listen to me as I describe to you what I've discovered may be the cause of some of your symptoms. Through the examination we've had today, it seems most readily apparent to me that a lot of your pain seems to be primarily focused on your back. Most of the pain seems to be coming primarily from the back. It sounds simple at first, but the back is actually pretty complex. There's a number of mechanical structures that can add to pain, and that's why we've just gone through the examination that we have. It's allowed me to look for a number of things that may indicate what might be the cause of your back pain, and I'd like to discuss some of those causes with you now. There are a number of muscles that help to support the spine, and many people have trouble with muscles. If you look, there's many muscles that support the spine. There's long muscles that will attach clear from even down by the tailbone, clear up to almost in between the shoulder blades. Those help to hold the back up. There are a number of muscles that come in at different angles also, either down low, mid-back, or even higher in the back, that help to stabilize other structures such as the ribs, the shoulders. Some of these oblique muscles will also help with rotation of the back. And so any and all of those muscles can be at risk for being irritated or possibly being overworked or overloaded. If that's the case, they can become symptomatic and they can be a cause of pain. We talk about back pain for one reason. It's in the back of the body. If you look, your spine is sometimes called the backbone, and the reason it's called the backbone because it resides in the back of the body. If you're to look at the spine, if you're to treat the body like a teeter-totter and everything we're centering on the spine, and you're to put that teeter-totter across the spine, you see that obviously this side of that teeter-totter will be much longer than this side. If that were the case, everyone would be falling forward. The reason they don't fall forward, however, is because those muscles we talked about are attaching all along the back of the spine and pulling to help hold things up. So if muscles get overworked or fatigued, you can see their job is primarily that of holding the back up. And if they get fatigued or sore, that can be a source of pain. Unfortunately, unlike other muscles that get overworked or strained, you can't just put those muscles on rest. As soon as you get out of bed in the morning, those muscles are working. They have to work to hold you upright, otherwise we would all be falling forward. So if people have myofascial back pain, or pain that's related to the muscles or the fascia that holds and supports the muscles, they don't get to rest. As long as you're sitting or standing upright, those muscles are at work. And because of that, that can be a constant source of ongoing pain. If that's the case, what we need to do is we need to work at getting those muscles conditioned so that they will help to support the body. If for any reason those muscles don't get an adequate blood supply or oxygen supply, they get starved for the nutrients they need to work, and when they do so, they start to ache. For that reason, we like to make sure that those muscles are working optimally. In order to do that, we need to make sure that they're processing blood and oxygen very efficiently. Now, if you are exposed to smoking, or if you're involved in smoking, that can be very bad for the muscles and their ability to gain oxygen and nutrients. Tobacco smoke has carbon monoxide in it. That robs the blood supply of precious oxygen, and oxygen is fuel for the muscles. So if you're smoking and the oxygen is being robbed, you're getting less oxygen to the muscles. Also, the nicotine that's in tobacco products tends to clamp down or constrict blood vessels and decreases blood flow. Once again, limiting the supply of oxygen and nutrients that the muscles need. So smoking can be very bad for mechanical back pain. If you're involved in the use of tobacco products or smoking, that needs to be stopped if you really want a good chance at improving your symptoms and your pain. On the other side of things, to make sure that they are optimally gaining oxygen and nutrients, the muscles need to be running efficiently. And so we would recommend that you work on a therapy program. Now there's two aspects to physical therapy. One is conditioning the muscles. In other words, helping them to run efficiently. And that can be with light aerobic conditioning. We're not asking for heavy weightlifting. We don't want to overstrain the muscles, but we do want to get them to where they process oxygen and nutrients. And so a conditioning program of physical therapy can be very effective. The other thing that we want to make sure is that those muscles have an opportunity to relax easily. If they're always contracted, they will use more oxygen, more nutrients, they're more likely to cramp and cause pain. So the second aspect of physical therapy is a flexibility program. We want to make sure that you're doing stretching on a regular basis. Now, physical therapy can be done with a physical therapist, but my feeling is every good physical therapist will try and work themselves out of a job in about a month or 6 weeks. They'll try and educate you on ways that you can do the therapy on your own at home. One of the things that we recommend is that you start doing some stretches on your own at home. And we can demonstrate these, and we have a guide that we can share with you that shows some of the stretches that we like people to start using at home. I recommend that when you do that, you also use moist heat with your stretching. So if you can take a shower or a warm bath immediately before doing a stretch, that would be helpful. You could even take a heating pad and put a washcloth under it, lay on it for 3 to 5 minutes to allow the moist heat to soak into the muscles. By doing so, what that does, it dilates the blood vessels, increases the blood flow, and helps the muscles to relax before you stretch, so your stretches are more effective. If you don't have a heating pad, you could even just get a bath towel or even a hand towel, moisten it, put it in the microwave, and use that as a heat source. But if you're using moist heat with your stretching, it's going to be much more effective. So it would be very effective to use stretching in association with moist heat to really gain the flexibility your muscles need. We do have a handout that shows many of the stretches, and our nurses would be happy to share that with you and show you the stretches that you could be using at home to start that process on your own. If you attempt the stretches and exercises that we demonstrate for you and that the nurses give to you, we hope that that will make a positive difference. If you find that you do that and they're not quite getting you where you want to be as far as your pain control goes, we can get you started with structured physical therapy. Physical therapy offices do have some modalities or some other treatments that you may not have at home that may be able to be helpful. We will give you a prescription for formal physical therapy today that you can use if your home therapy stretches and exercises are not effective. And if so, then you can contact the therapist of your choice, go in and start a formal physical therapy program with them. There are also some mechanical reasons for back pain besides just the muscles. Arthritis can occur anywhere in the body, and the spine is certainly no exception. When we looked at your x-ray, I may have noted to you some areas where you may be getting some early or even some advanced arthritis. If this occurs, another treatment option that may be available to you would be some steroid injections. Now, steroid is not a cure for arthritis. It's not a permanent cure for back pain. But it can be at least a temporary relief for some of the symptoms caused by arthritis. There are joints in the spine, and they connect the spine, and with motion, these things move. Now, if there's arthritis in these joints and it's causing significant pain, we're not going to be able to get rid of the arthritis. But just like a large joint, like a hip or a knee, will benefit from steroid injections for sometimes up to a few months, these small joints can also benefit from that. So if the physical therapy has not been fully effective and you feel that facet injection may be helpful, and we've discussed it today, you can certainly call us. I don't want to have to make you come in for an extra appointment just to tell me you'd like this. If we've discussed this and we feel that this may be an option to consider in the future, you could call in the future to let us know that your physical therapy has not been as effective as you'd like, and you can schedule your facet injections over the phone with our nurses. I'll see you for that facet injection, and after that, if you'd like, we could then see you for a follow-up to check on the results of the facet injections. Myself, or Brian Turman, the physician assistant that works with me, may have mentioned some changes we noticed in your discs on x-rays when we reviewed them with you earlier. Just as a review for what can happen to discs over time, when you stand upright and there's pressure that's applied to the disc, those discs can lose water content over time. And when that occurs, the discs can lose height. Now, some people call that degenerative disc disease. We tend to call it age, because it's not really a disease process. It's simply a matter of the wear and tear that occurs on a disc over time. Discs can sometimes cause pain. It's very infrequent that that occurs, since this is a normal aging process. So what we notice when the discs do lose height, that there is a process that occurs. Not only do the discs lose height in the front, but that can also affect what occurs in the back of of the spine. Between the vertebrae, there are joints that connect the vertebrae together, and those are called facet joints. When the discs lose height in the front, that can translate extra pressure to the joints in between the vertebrae and the back. These facet joints then can develop increased load, and that can subsequently result in arthritis over time. This arthritis can also be a source of back pain. So I hope this explanation has helped you today to understand what may be a source of your back pain. We've talked about the muscles as a source of back pain. We've talked about the skeleton, the bones, the joints that connect those vertebrae. We've also talked about the discs and how they can play a role in the mechanics of your back pain. We hope that in doing this, you have a better understanding of the things that may be creating and causing your back pain. There are times that no matter what you do, you're going to still have some mechanical back pain. The back has served you well your entire life, but it's also going to be with you for the rest of your life. And if there's still continued pain, we may not be able to get rid of it, but we want to try and manage it. If there's still ongoing pain, one other treatment that is available is what's called a TENS unit. TENS stands for transcutaneous electroneural stimulation. With that, you basically can put sticky pads on your skin, and between those pads, a very small current will be sent. The reason for this is nerve signals to the brain are just small electrical signals that go through the nerves. Now, if you are able to confuse or stop some of those signals so the brain doesn't get them, the brain does not register as much pain and you don't experience as much pain. So what the TENS unit does, it tends to put a signal across the area of your pain and block some of those pain signals that are headed to the brain. Most people find that they can receive approximately 30% relief of their overall pain just by using this modality. So if we can't cure or really resolve the causes of your pain and there's still continued ongoing pain, you can contact us. We'd be happy to prescribe a physical therapy program whereby you go to the physical therapist and get started on a TENS trial. Now, the trial needs to be tried in the physical therapist's office. If it's effective there, then they will prescribe a TENS unit for you to use at home. If you use that for 30 days or more and we can document continuous benefit throughout that 30-day process, then we can usually fill out paperwork to send to your insurance company to try and get a permanent TENS unit for you to use on your own at home. So I hope this description has helped you understand a little bit more what the causes may be for your back pain and what the solutions are that we can help to provide you. At the end of this, our nurses will speak with you and kind of go over some of the treatments we've talked about already. We'll figure out those that you've already tried. Those that you have not tried, we'll try and help to institute those so that we can hopefully help you gain better relief of your back pain. Any other questions that you have, myself or Brian Turman, the physician assistant that works with me, will come in and we'd be happy to answer any other questions you have pertinent to your specific complaints.